Well, Carl, tell us about this Fair Cost Health Plan.
Sure. Shawn, it was really spurred from not being able to find a plan and programs for our clients. And we basically, for all intents purposes, deconstructed and unbundled and rebuilt the system, as we like to talk about a house, if you will, and brought all these bricks, which represent cost containment solutions, together under one roof, 26 plus solutions that make up this custom employer built, actively managed health plan that we call Fair Cost. And that was what was unique. Most of the plans out there, what we call insurer built, built by the insurance companies, and they're passively managed because the employers allow the insurance companies to manage their plans. And last time I checked, the insurance companies are not in the healthcare business. They're in the money-making business. So that's what we really did. And we brought them and seamlessly integrated 26 plus solutions together on this platform we call the Fair Cost Health Plan.
So give us some examples of saving over the traditional BUCA, as we call it, insurance plans.
You want a couple of examples of what can be achieved? Okay. Yep. Well, I tell you, man, you better pack a lunch. I can go all day. Don't we have 4 hours or?
Yeah, 8.
Okay, good. Well, geez, okay, that's good. I had 10 in my mind, so I can make 8 work. But no, we've got a hotel that I can say the names of these clients because they've been on center stage and in the media. The Gasparilla Inn and Club, they were one of the ones that was right where Hurricane Ian and I came on to land, right down there by them. And they're going to open up hopefully mid-December. They normally open up October the 6th, so they are a little behind, but nothing catastrophic for them, thankfully. But they're about 450 employees, and we average about 180 on the health plan. Gets a little tricky because they closed July 5th and reopened, like I said, October 6th. So we'll swell up to about 250 on the plan, and then we'll go down to about 140 on the plan for a few months. And then October, November, December, they start building back up. So we just always say they average about 180 employees. Since they put our plan in and haven't updated the numbers as of the end of the plan year in July of this year, if they had self-insured with a BUCA, when we met them, they were fully insured. And in July 1st, 2016, they took the maiden voyage on the Fair Cost Health Plan. Glenn Price, the CFO, and Liz Schrock, the benefits champion, deserve a lot of the credit for going down this road with us. But if they had self-funded, say, with United Healthcare, back July 1 of 16 through, I would say I'd have to go back probably to 21, July 21. They saved about $5.9 million or 61%. If that makes any sense, but I want to be clear, It really isn't that much savings because they didn't stay with the insurer-built plan. They made the switch. But had they been with the insurer-built plan, we can prove and people where I met you guys in Dallas at Free Market Medical saw that. So that's one example of what can happen, as crazy as that is. But they really didn't pocket $6 million. I want to be clear. They saved the first year. And am I making sense?
Yeah. Yeah.
Okay. I think you're lying. I think you're lying to me, but anyway. But then the second one is DeSoto Memorial Hospital. That was the post you saw this weekend at the DPC Nuts and Bolts conference in Dallas. We were there sharing the DeSoto case study that's been shared again all around the country. It's a rural hospital, 49 beds, in the fourth poorest county in the state of Florida, the second lowest family median income in the state of Florida. And the first year we worked with them on the Fair Cost Health Plan, and I want to throw out Dr. Lee Groves. He's the one that brought us, and a guy named Sean Pruner. They brought us to DeSoto Memorial. I didn't know where Arcadia, Florida was. If you had told me about Arcadia, Florida, I went, did you make that up? I don't know what that is. And so that's how myself and my co-founder, Mitigate Partners, Barry Murphy, and I got involved. The first year on with Fair Cost and with Dr. Gross serving as an Epiphany Health Direct Primary Care, serving as the quarterback of our health plan and the foundation of that house we described, the Fair Cost plan, they saved $1.2 million or 54% in 1 year by eliminating a BUCA plan. They were a self-funded plan. They eliminated the BUCA, eliminated the PBM that the BUCA owns, and were able to do this and dump that BUCA network. And the savings was 54% or $1.2 million. And with that, they hired their first full-time surgeon in county history. And now our goal is to reach in the community. We've tried 3 times. We got derailed by COVID twice. And then, of course, Hurricane Ian, they had severe catastrophic flooding down there. If you watched the news, you would have seen Arcadia. Really bad. And so the hospital leadership's unbelievable. They slept at the hospital for a week and a half. And matter of fact, Vince Sika, the CEO, was supposed to be with us in Dallas on last Friday, but he was staying back for, disaster preparedness for Hurricane Nicole. That I don't think ended up having really any effect on them, but he had to stay. So he couldn't be with Dr. Gross and I. It should have been. He's a Florida Gator and a Georgia Bulldog. Of course, Georgia Bulldogs going to always do better than a Florida Gator. But anyway, that's a whole nother day, another story if you want to go there. But that's a pretty amazing story in itself. And we're trying to bring the city, the county, and the school together on this platform. All of our plans, pretty much, Shawn and Janet, have no deductibles, no barriers to care for the members. It is totally a patient-centered plan. Instead of the patient sitting over here on the periphery as a profit center, we bring them front and center, let them interact with the local care team, you guys, the pharmacist, the doctor, the hospital, all of them together working without all the interference of all these third-party middlemen. That's one. Another one is a school district of Osceola County. I stepped out of this case April of 21. But my partner, Barry Murphy, is still involved in over a 2-year period. First year, they were with Cigna. That was a multi-year contract, so we couldn't do anything about that cartel situation. So we saved them $6 million the first year with a lot of brought in green imaging. Dr. Dickerson, y'all know Dr. Dickerson, I'm sure. And that was her big case study that she shares a lot around the country, is that case study. And then the second year is $15 million. So over 2 years, about a 6,500 employee company school district saved about 31% or $21 million. So you've got large employers, and then you got 157 employee hospital and 180 employee hotel. But the savings, I would tell you, is going to range, 30 to, as crazy as everybody will tell me for saying it, 61%. I was proven, so let's go.